I put it in. Sure.
Okay, very welcome to this session on health and its interlinkages with climate and nature. My name is Berglof. I'm the chief economist at the Asian Infrastructure Investment Bank. I'm very honored to have this opportunity to talk about a topic that is very close to my heart and to the heart of the bank. You know, climate is the single biggest killer and the biggest health threat that we are facing. And in addition, of course, it's also turning people into poverty, and we know that poverty is something that also comes with disease and vulnerability. And we also know that its impact will only intensify. And of course, it's hitting low and income countries much more than rich countries. You know, we have had major achievements in global health over the last 3 decades or so. And it's remarkable what has been achieved in terms of life expectancy, in terms of child mortality and so on, and the many diseases that we have managed to control and in some cases even eradicate. So these gains are now at stake or are under threat from the impact of climate and nature loss. So we, the AIIB published 2 successive reports, one on climate and one on nature, and now we are trying to tie this together with the health aspect. And you know, this is of course not just to focus on those dimensions, but it's also to think about how can we increase the investment in climate using the health argument. How can we use the health argument to invest in nature? But also the other way around. We know that there's a lot of capital around looking for opportunities to invest in climate and nature, and we can use that to get those improvements in health that we saw were so needed when we just had our COVID pandemic. So there is a very important link between these 3 topics, and that's what this year's flagship report, what we call the Asian Infrastructure Finance report, is going to deal with. And we're going to have a panel discussion here and also have a short presentation of the early findings from this report. It's really very much sort of a consultation exercise. We'll get some feedback from the panel, and we hope very much to get it from the audience as well. And the focus that we take is on infrastructure. You can understand that the bank, the Asian Infrastructure Investment Bank, trying to understand, you know, what can we do to influence this relationship between climate, nature, and health? Obviously, we can invest in the health sector itself, and we do, and we have done since several years, starting building a portfolio in the health sector. But actually, there's so much more we can do through the other things we do, the things we do on energy, the things we do on transport, the things we do on water, the things we do on digital. And also last year, we launched our report, Nature as Infrastructure, really thinking of nature as the most critical infrastructure for sustaining life on Earth. If we can start thinking about how can we invest in nature and look at bringing out the health impact that those investments can have, I think it opens up a lot of interesting possibilities. So, I guess that's all I'm going to say as an introduction. I hope that we can have a conversation on it. We are very privileged. We have the Vice Minister of Finance from Indonesia, Suhasil Natsara, here, and he has offered to give us a keynote address on this topic. And of course, we know Indonesia is very committed. We are actually part of a mega investment in health in Indonesia, 4 billion for multilateral development banks coming together. We have 1 billion of that. It's really a whole new way of thinking about how we can get massive resources into building health systems. And we know that it's really about systemic thinking, and that's also what we think why climate, nature, and health should be brought together. So we very much excited to have the minister here. And I just give a very brief background. So he's been a Vice Minister of Finance since 2019. He has had many different roles in his current capacity, but maybe the one that struck me the most was that he was in charge of the recovery effort after the COVID pandemic, which, as we know, hit the emerging and developing world much more powerfully than the advanced economy. So I think he has a lot to share with us about the significance of health and the link between climate, nature, and health. I'm also delighted, like as me, he's also a recovering academic. He had a very prominent academic career in Indonesia, and we trained outside Indonesia as well, and has played a very important role in developing development economics in Indonesia. So without further ado, Mr. Minister, please, the floor is yours.
Eric, thank you so much for the very kind introduction. And it is my privilege, it's my honor to be here to give you an address on this topic, the climate and nature. Distinguished guests, ladies and gentlemen, colleagues, I believe that if we put together the words nature and health 20 years ago, it doesn't make sense. I mean, the two are really stand out by itself. It's very important. Nature is very important. Health is very important. But nature, health, and climate, 20 years ago, we thought that, yeah, they are all important, but then are they really related? Right now, it's very natural. We think they are related. And it is very important that we continue to look at to produce studies, to produce knowledge on all of these three forefronts. And let me quote the current study by the World Bank and the World Health Organization that strikingly, in 2030, climate change could drive an additional 132 million people into extreme poverty. This is a number, and this is a situation that I believe is not acceptable. As much as not acceptable that 44 million people could experience direct health consequences from health-related impacts. These are not acceptable, and we have to do something about this. The projected annual healthcare costs associated with these impacts could range from 2 to 4 billion US dollar. It's too big for our world, is too big for our society. This may end up as a financial burden that can easily overwhelm the health system. And for the developing countries who are grappling with the twin challenges of poverty and inadequate healthcare infrastructure, this is also not acceptable. That is why it is encouraging to see that during the COP28, the global community signed the Declaration on Climate and Health. This is a landmark declaration, establishing that health is a critical dimension on climate action, marking the turning point on how we should approach our climate policy and how we should approach our health policy. We are no longer in the luxury of treating climate change as the environmental issues alone. It is an issue of survival for millions with profound implications for global public health. And of course, integration of health into climate policy really reframes health as a global public goods. Of course, more of this we realize after, since we entered the pandemic, the COVID-19 pandemic, that strike us, the whole world, that is, health is very, very important. It is more than just building infrastructure. It is about the attitude. It is about the mitigation. And it is also about the recovery from a very severe situation like the COVID. And together with that, for a number of years, we have already been thinking about how the climate change can be recognized. The climate is for 2 decades, or maybe almost 3 decades, we recognize as a global public goods. Nevertheless, it is very unfortunate that as much as we recognize the global public goods like this, but the Copenhagen Accord in 2010, where developed nations pledged to mobilize 100 billion annually for by 2020 for climate change, for the climate finance, we haven't seen it. And of course, it takes more than just a statement. It is very important that if we go to the COP29, we must ensure that this pledge is not just honored, but also surpassed. The upcoming negotiations of the new collective quantified goal on climate finance is a way that offer critical opportunity to re-establish the trust, particularly for the developing nations who mostly borne the brunt of climate impacts despite contributing the least to the problem. The 100 billion commitments must serve as a floor rather than the ceiling of the commitment of the whole world. In this context, ladies and gentlemen, let me share with you very briefly several things that Indonesia has participated in the global context. Linking climate and health on the global stage, Indonesia has initiated and continue with the discussion under the G20 Joint Finance and Health Task Force. Indonesia co-chaired in the past and is already engaging detailed discussions that explores the intersections of climate change and health financing. On the other hand, Indonesia is also co-chairing what is called as the Coalition of Finance Ministers for Climate Action, another platform that we co-chaired by Indonesia with other countries to prove indispensable for the advocation of the integration of health consideration with climate finance framework. I remember clearly when this coalition was first established. This is sometime before the COVID. I think it's 2017, 2018. At that time, those colleagues who are really into the climate actions finally realized that the climate action can only succeed if the ministers of finance are actually sitting around the table and listens to the climate issues and then allocate money. It's not easy for the ministers of finance usually to allocate money, and I can tell you that usually there is no short of brilliant arguments from every single sector in the country to argue for more budget allocation. And that is what the CFO usually has to face, and the colleagues in the climate action realize that, okay, we have to get these finance ministers to sit around the table and listen to us. And then along the way, up to now, the finance ministers becoming also very fluent in talking about the climate actions. That is how it came about. And the joint task on finance and health is also doing exactly that. So it's very important that the finance ministers are also fluent in talking about the health sector and can act accordingly. Now, those two are in the policy frameworks area. We realize in Indonesia that it is also very important to be very operational. Not only talking about the policy changes, but also talking about what can Indonesia offer in order to reduce the climate burdens. So Indonesia also established the Indonesia Energy Transition Mechanism country platform. Through this platform, we are offering a number of coal power plants that we can early retire, but has to be done in the right financial structure, and this is the structure that can invite the international money to come in. We established the Indonesia Stock Exchange, the carbon exchange under the Indonesian Stock Exchange as examples on how we channeling resources to accelerate the development of climate resilient and healthcare infrastructure in the developing countries. Indonesia is also continued to show commitment in this climate resilient health system, and in earlier April this year, Indonesian Ministry of Health, the UNDP and the World Health Organization signed a joint agreement to implement a project funded by the Green Climate Fund. So this is another intersection of the health and climate, and this initiative is a global climate and health investment that seeks to strengthen health system through both climate adaptation and mitigation, climate mitigation solutions. Eric earlier mentioned about Indonesian Ministry of Finance that has just initiated 4 billion, we call it in Indonesia, the mega loan. 4 billion to improve the health infrastructure in Indonesia, and we are hoping that it will come about. And AIIB is one of the co-financiers of that particular loan. And ladies and gentlemen, as of now, Indonesia is in the period of looking at the transition. Next month, there will be a new president, new cabinet, new administration in the process. And this is, and I'm very happy to inform to all of you that this transition is going to serve the continuation in the process. The continuation from President Joko Widodo to President-elect Prabowo. This is something that is also will be very important for the region, for the stability, and for the progress. We ask the new upcoming government, what are their priorities? The priorities are education, health, food security. And then we come up with another question. What about infrastructure? The very clear answer that we get is that if in order for the education, health, and food security, we build the infrastructure, we continue to build the infrastructure. We build the infrastructure for a purpose. We We are not building infrastructure for the sake of infrastructure. We are building infrastructure to improve our health, our education, and also our food security. This is a mindset, another fundamental mindset change that I really hope that in many years to come, it will be very beneficial for Indonesia and for the region. So ladies and gentlemen, let me stop there. And closing, I would like to say that the time for action is now. Climate change is not only an environmental issue, it's a global health emergency, financial challenge, and also a moral imperative for our generation. We must act decisively to ensure that health is integrated into every climate action that we take. And from the negotiation tables of the COP29 to the smallest health clinic in rural areas, we must be united in our efforts to protect both the planet and the people who inhabit our world. Let us commit today to turning our promises into concrete actions, our idea into innovations, our shared visions into a healthier, more resilient future. Thank you very much. Thank you, Eric.
Can you take a question or you have to?
I need to run. Oh yeah, I can have questions. 10 minutes.
Sure. So thank you so much, Minister. And you know, you said many things, but you also symbolize something which you were speaking about, that the need to bring together finance and health, finance and climate. And it's only when the finance ministers or the finance ministry is at the table that you can actually get real action. And I think you have shown that also in practical experience. And you have been part of creating the pandemic fund, which was very much part of the Indonesian G20 presidency. The joint finance health task force is also a creation that came out of that, and I know you're co-leading that, and it's very important. There was one thing you said at the end, which I think also really resonates with us, is, you know, we're not building infrastructure for the sake of infrastructure. We are building infrastructure because we want to achieve something. And, you know, when we are building infrastructure, we are locking in countries for decades, and if we get it wrong, you know, we have to live with it. If we get it right, it can really benefit us. And if we get the wrong infrastructure, you know, that does not respect climate, nature, and health, you know, we'll have to live with that. But what we are trying to show, and this is what my colleagues will in a minute try to show, how we can use infrastructure to achieve these health targets and along with climate and nature targets. I know you have to rush, but if there's a question for the minister, he's kindly offered to stay for that. Any question?
Very good. So I can go to the round table.
Okay. Can you just introduce yourself? Sorry.
Introduce myself?
Yeah.
Well, I'm a former staff of the Asian Development Bank.
Okay.
Where
Well, you're welcome anyhow.
I worked there for 20 years.
Yeah.
And I went through to your lovely country many times on missions, and, you know, at the time of the 1997 financial crisis. And you referred in your speech to the power plants that were built around that time and later. And now I heard a very nice thing from you of retiring those plants. If you could briefly summarize what's the strategy for retiring coal-fired power plants in your country?
About 1 or 2 years ago, we had the idea that maybe it's time for the early retirement. But then any coal power plant was established based on a contract, long-term projection, long-term contract, and so on. And it is very important to understand that long-term contracts are very important. The law is very important. But we would like to come up with something that is win-win for the government, for the investors, and also for the people. So it is very important that then what we do is we look at the contract again, and then say that a certain coal power plant should be in operation for 20 years, And then we start to ask questions. Can we early retire at the year number 12, year number 13, or year number 15, and then save 5, 7, 8 years of coal operation? Then the question is, what about honoring the previous contract that was signed like maybe 15 or 20 years ago? We can still honor that. We can still honor that. The investors still need to have certain degree of IRR, but then the loan can be refinanced. The refinancing of the loan can be tied up with building the new renewables, because the energy that are retired, the coal power plant that are retired, will have to be replaced by the new energy, the renewable energy power plant, because the economy is increasing, the demand is increasing. There is no way that our demand for electricity is declining. So we can find it's just a matter of financial numbers. And we are very happy that a number of multilateral development banks are with us, do the calculation. We engage with the JETP. We engage with the energy transition mechanism, the ETM platform. And then we can establish something that is win-win. The investors can continue to have the proper IRR. The country can save on the carbon. The people can save on the climate change. There is one thing, and this is something that I usually also talk about quite out loud. I asked my team, I asked the multilateral development banks teams, the amount of carbon that are saved, carbon emission that are saved, can we put that in a monetary term right now, rather than 15 years from now? The answer is still no. And I believe that if we can have like a forward value of carbon reduction, that even will make it even faster for the energy transition for the world. Right now, all carbon are spot. We have to create the forward value and offer it to the coal power plant for the early retirement.
Very quick question over there.
Yeah, I'm Eugene Simonov from Rivers Without Boundaries Coalition, and have a question on reasons behind the project selection for GTP. Early versions of the program that should be financed to achieve the transition was heavily biased towards relatively costly and relatively environmentally destructive hydropower, and there was relatively less solar in that program. I'm just curious whether it's changing over time of planning of GTP, because of obvious fact that on one hand it's solar may be environmentally less destructive, but on the other hand, because it's cheaper and much faster in development and much more certain in development. So is there any thinking about that right now, about shifting more to solar, or it's still a lot of hydropower in that plan?
Great. You may want to explain GTP.
I'll do the solar and water. Building the water hydro power plant takes years of planning. It is not something that you do in 2 years. Building a coal power plant, you can do it in 2 or 3 years. Okay? So for a country, in developing countries that have continuously economic growth, clearly there is a direct incentive to do it in a speedy way, build a coal power plant. Okay? There is the coal power plant. Now, hydro, if you can build hydro in 7 years, that is the time span. You have to start very, very early. That is what happens with the hydro. So that again, and then in addition to that, depending on the types of the country, whether they have the hydro resources or not, whether they have the coal resources or not. Most countries know. Indonesia has a lot of coal. There is another different incentives dynamics in play. Okay? But I believe that with the technology that comes in, a solar power plant is coming. In Indonesia, usually the most important problem with the solar power plant is with the land. How you acquire the land. How you make sure that the land is available for the solar panel to be put on top. In the last couple of years, Indonesia, we come up with a new solution. We put the solar power plant on top of the lake. And nobody actually claimed the lake. We don't have to release the lake from anyone's like land entitlement. So we start to build that. And I believe that this is the very smart solution that we have to replicate in a lot of area. And the solar, I think, is one solution. The other solution for a country like Indonesia is the geothermal. One problem with the geothermal is that the risk at the exploration stage is very high. High risk at the exploration stage, but it's actually very low risk, low maintenance or low operation costs during the operation period. Now, with this kind of problem, we think that the government or the state should step in. The government should come in at the exploration stage and then allow the government to bear some degree of cost of the exploration and then give it to the private sector once it becomes the production stage. This will make the different kinds of modality between hydro and solar and geothermal. But it is very important that the state actually understand what is going on and then allocate the taxpayers' money accordingly to the energy problem that we have. That is what we face in Indonesia, and that is what we are continue to find the solution in Indonesia. Thank you very much.
Thank you. Thank you very much, Minister, and good luck with this. And of course, we're now going to take it back to health from climate and show that it's very much linked. So thank you.
Thank you. Thank you so much. Thank you, everyone.
So we're now going to have a very quick presentation of the early results from this flagship that we are working on. Two of my colleagues, Vera Sirsho, who is the only scientist in the AIIB, the One Health senior scientist, or senior One Health scientist, and JP Chia, or Jiangping Chia, who is my deputy, and they will together present the early results of this. So thanks.
Good afternoon, everyone. Thank you for attending this session. And so we will continue on the early findings of this work that we have initiated for this year's flagship report. And I'm very happy to hear comments. This is a very complex topic and not easily solved, as we had comments here earlier. I think we all became witness to what health or not safeguarding our health can do to our societies and our economies during the COVID-19 pandemic. But what actually affects our health is mostly beyond the healthcare sector. So only about 10% what affects our health is within the healthcare sector, having access to medicine or healthcare facilities. The vast majority of the things that affects our health is really on breathing clean air, having fresh water, and being able to have clean environments, education, and so forth. I think we heard earlier what human-induced changes to climate and environment and biodiversity can do to our systems. And all of you can see in the outer rings here is affecting our environment, our industries, our infrastructure, and so forth. And it affects all of our organs in our body. It affects us in terms of mental health, cardiovascular diseases, cancer, antimicrobial resistance, maternal mortality, infant mortality, infertility, unintended pregnancies, and so forth. The list is long. Currently, about a quarter of the global burden of disease is due to non-avoidable environmental factors, and that is about 12.6 million people that die every year due to these factors. And we know that with climate change and nature degradation, these numbers will increase rapidly. And we also know that air pollution, for example, which is the biggest killers of environmental factors, 92% of air pollution happens in low and low-middle-income countries. And we know that Asia is one of the hotspots for climate change, and particularly vulnerable groups, people living in poverty, women, children, and elderly are particularly exposed to these factors. It is important to build a resilient healthcare infrastructure and resilient healthcare systems, but it's also important to invest in climate change, mitigation, adaptation, nature conservation, and in our sort of ecosystem services. So why are we doing this? We are now moving from a global health perspective into what we call a planetary health perspective, and that is really recognizing the intrinsic connections between human health and the health of our planet and our environment, and all living creatures on it. Energy, transport, power, telecommunications, and digital technologies really presents great opportunities to invest in improved health, and both for humans, but also for the planet. And we need to build a greener infrastructure that is resilient and works for everyone. I will now give over the word to my colleague to present a little bit on our early findings.
Good afternoon. I'll be very brief. I will walk you through a couple of results. But I promise you, you will not see the full results today, so make sure you read our report when it comes out in about 3 months' time. So let me first go through some very basic points. Now, on the right axis, on the x-axis is income. On the y-axis is mortality. So across country, you see that wealthier countries have lower mortality. Now, this is normal. We expected these results, right? So when you're wealthier, you have more resources, healthcare, otherwise your environment is better, your infrastructure quality is better, mortality is lower. But what is striking here is that even within the same group of countries with the same income, there's wide dispersions around health. So incomes is important, but incomes is not the only determining factor. So this is very clear from the chart. This chart I find striking, right? The blue dots are high-income countries. The red dots are developing countries. On the y-axis is, again, mortality. On the x-axis is the exposure to 2.5 PM 2.5 pollutions. Now, you look at a rich country. There's no correlation whatsoever. High pollution countries, low pollution countries, the mortality is low. But you look at the developing countries. For the same amount of air pollution, the mortality shoots up. Now, this is a new result to me, and I find it striking. Developing countries, the air pollution hits the developing countries' mortality very quickly when there's no such correlation at all for developed countries. Now, why? Then you begin to understand, of course, when you're a rich country, you have malls, you have air conditioning at home, you have air purifier, you have a controlled environment, you have better hospitals, you have better respiratory health in the hospitals, right? So you have all the kind of infrastructure that kind of prevents the air pollution from hitting you hard, right? But developing countries do not have this luxury. You turn the correlation to water quality. Now, how do we measure water quality? We use oxygen in the water. So the more oxygen in the water, the higher the water quality. The less oxygen, the poorer the water quality. Again, you look at the group of high-income countries with poor water quality, no effect whatsoever on the mortality. But you look at a group of developing countries with low water quality, what do you see? The mortality shoots up. Again, developing countries are more vulnerable to poor water quality. You look at the ecosystem. You measure the ecosystem intactness using a variety of measures. Again, for high-income countries, you see very little correlation. For low-income countries or developing countries, the moment the ecosystem gets destroyed, the mortality shoots up. The story just repeats and repeats and repeats. Now, I want to share with you very clearly that this is just correlation. This is not causation. We have no control for background factors, but the fact that the correlations consistently pick up this very consistent pattern suggests that something deeper is working. So in our report, we will also deal with causation. You will see a lot of control experiment studies. You will see a lot of natural experiment studies where we documented various things. Maybe one last thing very quickly before I pass the floor, share the floor back to Vera. In developing countries, in the developed countries, Gini coefficient has no correlation whatsoever with mortality. But in developing countries, the higher the inequality, the higher the mortality. Again, it speaks of access to healthcare, right? It's not just the income, the distribution matters. So look forward to the report. Vera will quickly bring you through a few quick results. I may jump in if I have something to say.
Thank you, JP. So some of our early findings in this report is really that I think what is a global finding in general is that life expectancy and quality of life and health has increased in the last decades at astonishing numbers. We live about 30 years longer than we used to live about 50 years ago. And this has increased globally, even in low and middle income countries at a relatively low income level. Another finding that we have found is that that we see in Asia examples that show that air quality can improve when we not only build clean energy, but we also look at how we provide the grid system, how we connect these grid systems, and how we actually create policies around that. We have also seen that rising temperatures increases infant mortality, floods and higher temperature increases infectious diseases and waterborne diseases, and extreme rainfall affects our food security and agriculture. We have also done one study that looks at lead. Lead causes about 2 million deaths on an annual basis, and we looked specifically at what it does in terms of Asian countries. We have 80% of the current lead in circulation globally today is used in electric batteries, and a lot of these countries don't have that import heavy amounts of lead for electric vehicles and solar panels and so forth, don't have the infrastructure to recycle its safety, creating a problem for health. We have also done a study on antimicrobial resistance. I think the global evidence is quite stagnant to see that the numbers are increasing. We particularly looked at a couple of countries where we see that up to the years of 2050, we look at a reduction of about 2 to 3 years in life expectancy in India and China respectively. We have also had a study, which is very interesting, looking at what actually keystone species, the loss of keystone species does to our health. There was an interesting collaboration we did with researchers that looked in India, where they had a drop in vulture population. And this affected the human population as vultures clean up our environment. So they can account for 100,000 additional deaths due to the drop in vultures on a yearly basis. So these were quite staggering numbers. We also know that non-communicable diseases are rising in all of the world, and we need to build up new type of social infrastructure around that. And we also know that elderly population is especially vulnerable to these conditions. And finally, we looked at investment infrastructure, improving air quality, water quality, cooling, and this is particularly important for low and middle income countries as they are the most exposed to this. I will wrap up here and give back the word to Eric to introduce our panel. Thank you.
You saw those numbers of these regressions that the GP showed. So he emphasized the aspect that these countries are more vulnerable to air pollution or to water quality deterioration and so on. The upside for an infrastructure bank is that, our investment wouldn't make all that much difference in rich countries, but in poor countries, these could really make a huge difference. So when people don't have these private means that JP talked about, having the purifiers in your home, if we can do something to improve air quality, water quality, and so on, the returns are so much greater in those countries. And I think that is a very important message from the report. Let me now shift to the panel. We are very excited to have four very prominent, coming from very different aspects of climate, nature, and health. Can I invite you to join me here on stage? So let me start from here. We have Nina Renshaw. She's head of health at the Clean Air Fund. I think the name says what you focus on is air pollution, and we will have a chance to ask you some questions on air pollution. We have Maria Vivas. She brings the local perspective. She is head of UNICEF here in Uzbekistan, and we are very much looking forward to translating this into the local context here. And then we have Grace Lang from Gates Foundation, working in China. Of course, Gates Foundation is immensely important for health globally, and their focus on technology. We'll hear more about that. And finally, Sidi Aryal from the Vital Strategies. It's a very good name for an organization that works on health, I think. So you have a broad experience from different parts of Asia, and we're looking forward to benefiting from that. So let me start with you, Nina. We have talked now a lot about climate, nature, and health, and how we can use infrastructure to affect climate, nature, and health, and how also sometimes when we think about these things, we think about them separately. So, of course, for people living in these environments, the fact of air pollution, the fact of heat, the fact of humidity, and the pollution in water and so on come together. Can you say a little bit what you have seen in terms of infrastructure that really can make a difference to address these things?
Thank you. Can you hear me? Yes.
Yeah.
Good afternoon, everybody. I'm delighted to be here. A quick word about Clean Air Fund before I start. Mm-hmm. Indeed, it does what it says on the label, basically. We're a philanthropy initiative, pooling funding to work on air pollution, so for better air quality for everyone around the world. We launched in 2019, so we're also not that old, but we've become the largest initiative to pool funding for air quality. So we've mobilized over $200 million to date, which normally to an audience sounds impressive, but to this one, I think you know that that's a drop in the ocean. Policy areas which are most important in this field to improve air quality, I would like to emphasize that greenhouse gas emissions, air pollution emissions from the health sector and its supply chain are just 5% of the global totals. So actually, the bank, as you've been saying, really needs to focus on the sectors that are the biggest emitters and polluters. These are also the sectors that are seeking major infrastructure investments, and the sectors where there's the biggest risk, as you were saying before, of this lock-in. So if we choose certain paths now, we'll be locked in for decades to come in terms of expectations of economic return and so on. So the banks collectively arguably have a much bigger positive health impact by focusing on those sectors, making sure that health is integrated in decisions through those sectors and the health benefits that you can have, rather than in healthcare investment specifically. And this is particularly acutely important in Asia because we were hearing about the very, very severe effects of air pollution in this region. If you look at a ranking globally of the countries where the proportion of the population is most exposed to poor air quality, dangerous levels of air pollution, all of the top 5 countries are in Asia. They are Bangladesh at the top, with 98% of the population is exposed to dangerous levels, followed by Nepal, India, Pakistan, and Singapore at 85%. Air pollution, as we were hearing before, is now actually the #1 driver for the global burden of disease around the world. So it's overtaken tobacco as a cause of ill health globally. And if you look at the investment and the public health policies that have gone into responding to the tobacco epidemic, you see that we have work to do to catch up in air pollution. You were talking about non-communicable diseases, and this is the biggest part of the health impact that air pollution is driving. So this is not only due to aging, but it's also due to the risk factors that are driving these non-communicable disease. So cardiovascular heart disease, strokes, dementia, respiratory disease, obviously, but also has a massive impact on children's health outcomes, miscarriages, stillbirths, under 5 mortality, and that one is related mostly to infectious diseases, pneumonia, but also there's a really high connection between areas of poor quality and COVID. So I wanted to emphasize, especially in Asia, there's an awful lot more that can be done, and the tide can be turned. So whereas some countries in Asia are currently losing 5 years of average life expectancy to air pollution, China is a great example. There's been a huge policy focus and investment focus on air quality in the last 10 years, and they've won back 2 years of average life expectancy. So that is a rapid turnaround and a rapid return on investment in terms of public health. So I'll leave it there, and I hope we can speak a bit more about solutions later on. Thank you.
I think that last statistic is quite impressive and just gives us hope that we can make progress. I'm going to come to you later, because I think I really want to get down to Uzbekistan's situation as well. But maybe, Sidi, I can ask you about, you have worked across Asia and you come from an organization that takes a global perspective. And when you look at infrastructure, what kind of things have been successful in scaling up and in also doing so rapidly? What is your main observation?
Thank you, Eric. It's nice to be here. Thank you for the opportunity. So Vital Strategies works in public health globally, and in the Asia-Pacific region, we have a number of programs which are cross-cutting, both in terms of communicable diseases as well as non-communicable diseases as well. And I think in terms of the communicable diseases, we work on TB in several countries in Asia-Pacific, including in Indonesia. But our work in non-communicable diseases is done in various different ways. So we work in road safety. We work in strengthening civil registration and vital statistics across many countries in Asia Pacific. But we also work in tobacco prevention and in alcohol abuse prevention, as well as food policy. So picking up on my colleague's point earlier on, about 1.5 years, 2 years ago, in partnership with Temasek Foundation, Vital Strategies undertook a landscape study and which looked at, this is just when we were coming out of COVID, and we looked at the pandemic preparedness landscape in 5 countries in Southeast Asia. And the findings indicated gaps that the nations had in terms of looking at integrated surveillance and several other recommendations that came out of it. So as a follow-up to that study, we did a deeper dive in 3 countries. We looked at Thailand, we looked at Indonesia, and we looked at Vietnam. And to your question, Eric, I think we made a number of observations, and I think for MDBs, to AIIB as well, this might be relevant. The good news is that most governments across Asia Pacific, there is a very high level of commitment to work in a collaborative fashion in terms of addressing the needs of the human health, animal health, and environmental health. while in several countries in Asia Pacific, that means that there are national action plans for One Health, which already exist. Several other countries have leveraged on existing plans on, for example, addressing antimicrobial resistance or addressing infectious disease or addressing pandemic preparedness to build the One Health agenda to it. On paper, things look great. But when you look at the actual, ability of the governments at the national level or at the peripheral level, at the local level, that ability doesn't really translate into coming up with funding for setting up laboratories that are able to address the multiple issues when you combine these three separate areas together. The architecture, the personnel. So I think for a bank, when you're looking to make investments in infrastructure, probably coming up with ways to conceptualize within infrastructure projects, within health projects, areas in which you might be able to integrate and deepen your funding. That's the first point. In terms of the second observation I'd like to share with you all is that there is a very health-focused and even a narrower health focused on infectious disease, typically on the zoonotic diseases when you talk about One Health programs, and that's true across the region. And I think this prevents the development and integration of holistic interventions that are required in One Health. And I think investments that the bank needs to make or wishes to make in areas like transport sector, areas like integrated urban planning, areas like labor policy or agricultural environmental investments, if there was a way for the bank to develop strategies to look at broadening this narrow focus and make it a little bit wider so that the implications of investments in one area can also consider the ramifications on the other areas, I think at a practical level, that would be extremely valuable. And I think the third point that I'd like to end with is, we as public health professionals have dealt with the issue around data access and data sharing. I mean, this is a story, our common story altogether. This is a challenge that we hear in the context of public health, it is true, but the need for better quality data and the need for integrated data systems to understand problems in a more holistic way get even that more pronounced. And this is why I say it. So from our work in One Health, it's an incredibly difficult challenge to address. There are political challenges from organizations and the governments, and we saw that during COVID as well. In fact, with Temasek Foundation, we were working to look at how can we house some of the capabilities in managing real-time data in Asia Pacific itself. Because remember, during COVID, we all needed to wake up, and check when the data downloads happened to find out the numbers of COVID infections in different parts of the world. So I think the challenges to make the systems, these are disparate systems across the three areas, to talk to one another would also be extremely important. And I think investments in that area would probably be very helpful. And one good news, and unfortunately the Vice Minister has already left from Indonesia, but the example that I'd like to leave you all with is Indonesia spent many years developing an integrated One Health information sharing platform. They call it SIZE, S-I-Z-E. It's called the System of Information on Zoonosis and Emerging Infectious Diseases, and it actually manages to connect the three information systems developed with a very engaged and collaborative effort across the three main ministries, which include the Ministry of Health, Ministry of Agriculture, and Ministry of Environment, with support from the US government, USAID, as well as support from FAO. So I think there are examples of good practices that already exist in the region, and I think within the context of shared, engagement that brings together different communities, different streams, probably in the infrastructure work for strengthening cities, if there is a way that we can connect within agriculture program, the availability of locally produced, highly nutritious food, and countries like India, countries like Indonesia have good examples of this to be scaled up rapidly, perhaps looking at models that can be scaled up in other parts of Asia Pacific, and indeed the world, would probably make good sense as well. Thank you.
Thank you very much. I'm now going to come to you and talk here a little bit about the Uzbek experience. We hear a lot about the progress that's been made in recent years in this country in terms of economic development thinking around issues. But we also know that this is a country that faces very severe climate impact, and of course we have some experience also of nature degradation and very significant impact from that. So how does it look from your perspective? You're based in Tashkent normally, but...
Yeah. Hello, I hope everyone can hear me. Thank you so much for the opportunity. I'll give you the Uzbekistan experience, but also some of the projections that we're going to be seeing. So basically, to put it bluntly, climate projections in Uzbekistan show that there's going to be rising temperatures by 5.4 degrees Celsius in 60 years. And this really means that every child born in Uzbekistan will be affected by climate change. And this is a country that has 1 million births each year. So the number is staggering. With the rising temperatures, we're going to see floods, we're going to see heat waves, droughts, and this will affect then agriculture, which is a major source of livelihood in the country. Affecting crop yield will affect food security, will affect nutrition. And this is not new for the country. We have seen this with the Aral Sea disaster, where we're still now dealing with the consequences. In the Republic of Karagal, Pakistan, we're still dealing with children who are malnourished, who don't have access to water, hygiene, and sanitation, have disproportionately higher rates of infant and under 5 mortality. Now, in terms of the rising temperatures, we've seen from the data that rising temperatures means high risk of heat-related illness. And this is particularly important for children and pregnant women. The data shows that children who are exposed to heat waves and high risk increased temperatures are more likely to be preterm or stillbirth. We also see that in pregnant women who are exposed to heat waves are also more likely to experience gestational diabetes or preeclampsia, which means we have high linkages of maternal mortality. Now, air pollution, Nina did a great job talking about air pollution and in terms of how it affects children. Uzbekistan is one of the countries that has reduced child mortality by 75% since 1990. But if within that, you still have a high number of newborn deaths. Every day, 60 newborns die in the country. And we know that newborns who are exposed to air pollution are at higher risk of being admitted into the neonatal care intensive unit, and at discharge, there are high risk for development delays or disabilities. So there is a high risk that if we don't put attention into air pollution, we are going to reverse the gains made in terms of infant mortality. And then the last bit I'm going to talk about is water, hygiene, and sanitation. Poor access to water, hygiene, and sanitation has links to increased transmission of fecal diarrheal diseases. This also affects the absorption of nutrition. In this country, 1 in 3 children suffer from 1 in 3 children 6 to 11 months suffer from anemia. And this also has an effect around stunting, around wasting, and affects the cognitive and physical development, and this is essential for human capital development. So just to say that it's not great, the prognosis, so we really have to make sure that the investments that we're making not only focus on the infrastructure, but we're also looking at the social impact aspect of it. So complementing all the infrastructure investments with making sure that our health systems are strengthened to be able to adapt to climate change, and making sure that communities and children are in the center of the programming.
Thank you very much. Grace, you come from an organization that has really transformed global health and now transforming planetary health as well. We see impact of temperature increases, of air pollution, flooding, vector-borne diseases, and you have pushed a lot the technology dimension. How can we respond to this using technologies of different kinds? And I'm sure you also can sympathize with the call for more data and more use of data in the system.
Yeah. Thank you, Eric. Good afternoon, everyone. It's such an honor to be here and contribute to all of you our thoughts on from the Gates Foundation and what we have done, and also just wanted to kind of highlight a couple of observations, having heard the presentation and also what my peer panelists have talked about. I think my very first observation that I want to share with all of you is that in the previous presentation and also the panelists talked about the waterborne diseases and zoonotics and data. One thing that I also want to highlight is the vector-borne diseases and how, so for example, like malaria, so I really want to use that as an example to show that how the climate change has really affected the basically bringing the new obstacles to the vector control, right? So we have collected lots of the data. So I want to give you an example that we should all remember the 2022 catastrophic floods that Pakistan had. And I want to ask you to think about the number after the flood. Can you guess what is the increase of the number of the malaria cases in Pakistan? So the country actually saw fourfold increase in the number of malaria cases as a result of the flood. It's quite shocking, isn't it? So that's only just one example to show that the climate change, how the climate change just because of one flooding has affected the number of malaria cases in one country. And so that is just one of the facts that we wanted to share. And from the Gates Foundation point of view, then I think, Eric, you alluded to it. So for us, it's very deep down in our nature is how we could introduce a new generation of game-changing innovations to help us improve the health quality. So that has always been the question that we have been challenging ourselves all the time. So Siti just talked about data. So one thing I also want to highlight here is, I think for banks, we talk a lot about hardcore infrastructure, and what about data and how we help with the digital infrastructure, right? So say, for example, the Gates Foundation has done quite a lot of research, and we firmly believe producing some real-time, high-quality data, linking with the modeling system, also the more of the sophisticated monitoring system would be able to help not only just our health workers, but also the finance ministers to think about where and when we can deploy our resources. So this is a really important point that I wanted to share with everyone sitting here. So one example, specific example that I could share in the malaria elimination process is we have created a big international research innovation network, which is called the Malaria Atlas Project. So the reason I want to mention this project is I think for banks, there is a way of thinking about making the best use of the available research innovation network and the data that we have to help you and help the country make best predictions of the estimated disease burden and how we can best deploy our resources to tackle that. Having evidence-based and actually with high quality data, we really help you do the monitoring. So that's a very important aspect that I want to share. The second aspect, which I think is not really thought about, is about producing accessible and affordable products. So what about diagnostics, right? So this is another thing that the foundation has been working on, is if you think about the rapid diagnostics tools, many of us will think about there is a huge need for the rapid diagnostics tools and the huge demand especially among the vulnerable communities. How we can produce and manufacture those rapid diagnostics tools really is an important question for us to think about. And then, of course, you will think about green manufacturing. How can we produce and manufacture these products? And then it comes to the local manufacturing aspect of it, and transport and process. So that's another aspect that I really want to share with you all as well. And finally, I want to leave this thought with you is based on the foundation's investments. We always feel that it is important to think more about preparing the crisis, how we can prepare for getting ready and then collect the data instead of recovering from the crisis. So this is why we think early investments linking with the research and innovation tools and also the data sets really important. Without thinking about that, hardcore infrastructure only might not contribute to the health and productive life that we want to save on the way to many disease eradication.
Thank you very much. I think these are very important observations. Early prevention is always cheaper than dealing with the disease later. We have some time for questions. I'm sorry, I think we need to share questions. Anyone else? No one? Yes, there's a question there. Please, sorry.
Thank you, Eric, and thanks to all the panelists for shedding light on very, very important issues. Fascinating discussion on health and its linkages with air quality, climate, and nature. My question is around monitoring of air quality, and we know in many developing countries, there are not enough monitoring stations, and the data and the quality of data that you have all alluded to is not really, we don't really have great data in terms of how, what was the level of 2.5 or PM 2.5 or PM 10 levels. I can give you one example. I'm from Pakistan, and I know that in the province that's Punjab, there are some monitoring stations, but at least what we hear is that many of them are not working. My question to you is that, this was just one example, but we know that there's a range of developing countries out there. How do you ensure that when we are talking about quality, the data that we collect, and we also saw the correlations of quality with mortality and many other indices that we talked about in AP's presentation. How do we ensure that we are actually measuring the air quality accurately? And are we putting in the right, systems there? Are we investing in those systems in the first place? Because in many cases, the data that we are getting is not from authentic sources, is not coming from, the systems which have high quality, monitoring devices available there. So, and how do we ensure that we actually do it across the developing countries? Thank you very much.
Okay, I'll park that for a moment. Are there other questions? There's one back there. Yeah. Can we give a microphone to the? Thank you. Sorry, you have to.
It's probably as a follow-up to the same.
Can you introduce yourself? Sorry.
Murad Sattarov, Director of Global Business Services, consulting company. Mm-hmm. It is related to the same problem of monitoring. What do you do with this problem of this institutional incentive structure, which is very obscured? We have observed that there are laboratories, there are institutions which have the equipment, there are government institutions which are legally mandated to do the monitoring, reporting, but the inherent nature of a relationship, the structure of the institutional legal framework is such that the the real institutional incentive is not in place. So even if you have equipment, resources, and materials, somehow nobody is interested to measure, to monitor, and to react in any meaningful way to whatever is happening. And since it is kind of collective damage, the individuals do not feel that it affects somebody individually. So you basically have the whole group of people neglecting and ignoring it because the institutional incentive in place is absent.
Okay, I think so we have to conclude, but I want to pick up these two questions. I think they are very much related. So, you know, it's great to have good data, and in some cases we do, in some cases we don't. But if there are not incentives in the system to respond to this data, and we should remember some of the discussions even in China came from the measurements of the American embassy and air pollution, and you know that started sending signals to others that maybe we should start looking at the air we are breathing. And so, how do you maybe start with your on air pollution if others want to come in?
Thank you. Thanks for the questions. I absolutely agree with the point that you're making, that there's a need for much more air quality measurement and monitoring, and funding for that, certainly. In the countries that are neglected so far, we see there's vastly different concentrations of air quality monitors in different places around the world. UNICEF has a great report from a few years ago which shows that I think it's only 1 in 600 children in Africa are within 50 kilometers of a reference grade air quality monitor. Since then, however, there's been huge leaps forward in the precision of low-cost sensors for air quality measurement. So one of the things that Clean Air Fund tries to do, we have a significant data program that helps get air quality monitors into the hands of local communities, into research institutions and universities. So happy to pick this up later on that question, but certainly there's a need for more funding in that area. More funding in general for air quality relevant projects. Actually, some great news is that AIIB is one of the world's top financing institutions for both projects that are directly addressing outdoor air pollution and projects that have outdoor air pollution health co-benefits. So AIIB is currently 3rd in the world alongside Japan as a government funder, and ADB for direct outdoor air quality projects, and 8th in the world for projects with air quality co-benefits. So we monitor this. We do an annual report called State of Global Air Quality Funding that looks at exactly this. What are the bilateral, multilateral government donors doing on air quality in general, either explicitly or as a co-benefit? And how can they do more? Because at the moment, this is a shocking figure, only 0.7%, so less than 1% of all international development funding is going to air quality projects. So there is, whilst AIIB is doing relatively well, it's relatively well in a very, very, very small pie, and there's much more that we need to do to increase the money that is going, both mobilizing new funds, but also making sure existing funds are being optimized to maximize the health benefit of these projects.
Maybe some very quick remarks on how to ensure that once we have the data, you know, maybe you can say something from the Uzbek perspective, you know, what is the quality of data, and are decision makers reacting to these data in a constructive way?
Yeah, I think it's, you might get me in trouble, but
that's why we're here.
Put me in the hot seat. I think it's exactly how you say, you know, in terms of there isn't a lot of incentives around data sharing. I think that's where investments in system strengthening and in governance come in key. We have to change our mentality from a punitive culture of making our country look bad to a problem-solving culture where we can collectively look at the data across subnational data as well and look at what are the gaps and where we can target. So I think that change in mentality and investing in system strengthening and in governance can really help change that.
City or Grace? Yeah.
Thank you. I think there are two things that I would say. So the first one is we heard in the Minister's speech just now, I think that the point that he brought up, and which I very much agree, is actually how we are able to convert the analysis of the data in a language that the policymakers can actually understand. I honestly think, when we talk about the data that we have generated, sometimes they are not made good use of. But then I always challenge back is that have we actually done enough analysis of that data, and also have we converted them into a kind of a knowledge that the policymakers can really understand before we ask them to produce incentivized policies, right? So that's the very first question I would say, and the cross-sectoral approach is really important. And the second point I would also want to say that I also very much share the point that Maria just mentioned. So that's before my time with the Gates Foundation, and I pretty much led a big flagship challenge program on behalf of the UK's National Funding Agency working with China. So Eric alluded to the challenge that I actually experienced leading my team there. Doing that is the challenge of getting the data, and sometimes there is a challenge of the government releasing the real-time data. But I also think that I agree with Maria, there is another thing we think about is the timing factor of it. So if you put it from the longer time period, the research that we have generated throughout that research process, there is actually some evidence showing that some of the policy changes have resulted in positive impact. Again, I think never underestimate demonstrating even the smallest positive change that the research has brought to the policymakers. And creating that kind of positive mentality is really important.
Thank you. So I just want to add something to what Grace said. I think it's important that policymakers have access to data, but building on the question from both the gentlemen, the research that we did in One Health has brought out several examples that the quality and usefulness of the data to the actual people that are reporting the data into the system needs to be explored more. There is an example from Thailand in the veterinary sector where the pig farmers were giving data about diseases in their farms, but there were insights that they also could leverage as a feedback mechanism which incentivized farmers to report more data. I think when we think about engaging with policymakers, I think at one level, we also need to be very smart in terms of engaging with people on the ground and producing utility for them for the information that they provide. I think this is going to be a game changer. We as a world public health community have done that with the way that HIV program, for example, was mainstreamed through the different avenues. And I think with planetary health, perhaps an area of investment would also be broaden the reach of data and ways in which data feedback loop is cultivated and brought back to the communities as well. Thank you.
Thank you very much. And the minister said, we used to treat these areas, health, climate, nature, as separate areas, important in their own right. Hopefully you leave this conversation convinced that they are very much related. We know that nature and climate are very closely related, affect each other. Climate and health, we have had many examples of this, and also I think in the report there were very clear examples of how nature and health are linked together. So that is planetary health, and I think what we really have shown also in this conversation and also now with the panel is that infrastructure is a very powerful and very potentially very effective way of thinking about how you can affect these health outcomes by investing in energy, in transport, in water, and so on. Thank you very much for staying with us. I hope you have taken some things away from this. Thank you very much to the panel. Thank you so much.